Since the first case of COVID-19 was confirmed here in Korea on January 20th, about 4 months ago, it feels much longer than that though, we've seen the first wave sort of peak and then go away. And the current government was praised globally for the way it handled that initial outbreak. And we managed to return to everyday life quarantine without undergoing a major lockdown, and schools have also started to reopen. But of course, we have seen several surges in the number of infections, and it's clear that the pandemic is here to stay with us, at least for the foreseeable future. Now, the past several months of living with the risk and the changes that it has brought has taken a psychological toll on ordinary Koreans. A recent survey of 1,500 Koreans nationwide by Gyeonggi Research Institute found that nearly 48% are suffering from some form of anxiety or depression. So to give us a better perspective on the issues related to mental health, we're joined on the line by Dr. Curie Park, who is a licensed clinical psychologist. She's also the director of the Mind Care Center, an outpatient clinic for both Korean and international clients. Good morning, Dr. Park.
Good morning.
Thank you so much for joining us. All right, let's begin with this sort of an overview, I guess, of Koreans' mental state. I think we have gone through a roller coaster of emotions. Initially, we had maybe the second biggest outbreak outside of China. We were kind of shunned by the world. But then we got over that very quickly. And then we were praised all over the world for our quick response and our effective response. But now we thought we had got over the worst of it, but we're seeing these constant surges, and of course the global situation is no better as well. So Dr. Park, let me ask you first, where do you think that Koreans are right now in their sort of the roller coaster of emotions?
Well, as the director of an outpatient clinic, it's a little bit hard to tell because, my sample size is a little bit limited. But in terms of the people that we were already working with, interestingly, we didn't see a huge spike in difficulties, partly because I think one small benefit of not being able to go out much or have a lot of social interaction is that for people with social anxiety, this has actually proved to be a blessing in disguise because they're not being forced to interact with others. So we've been seeing a little bit of kind of a small benefit in that way. However, for the rest of the people that I meet on a regular basis, friends and acquaintances, are all talking about a spike in anxiety and difficulty with some depressive symptoms.
Do you think the fact that you're not seeing a big spike in the number of maybe patients coming to you related to the COVID-19 directly is a sign maybe of Koreans' sort of tendency to keep their emotions bottled up? I mean, we are not known for being exactly very expressive with our emotions. I imagine that's why many of your patients may have issues with social anxiety to begin with.
On the one hand, I think that's actually absolutely true. I also think that right now, what people are describing is a sense of shared helplessness and shared sense of uncertainty, which is giving rise to feelings of feeling negative and angry a lot of the time. But because it is shared, I think when we have something to attribute our difficulties to, then I think that the Korean tendency might be to wait it out a little bit. So the sense of, well, we know why we're feeling this way. So once the COVID situation clears up, then I should feel better is, I think, the way that a lot of people are feeling, and maybe why people are not seeking help immediately.
That collective nature sometimes works in our favor and sometimes against, I think. As you mentioned, some people are feeling angry. There was another survey that I read. Initially, a lot of Koreans just felt a lot of anxiety and maybe fear due to the risk of maybe catching the virus. But nowadays, I think a lot of that fear and anxiety has actually turned to rage because most people have been abiding by the sort of the guidelines that have been set out by authorities. But when we see these deviant cases, or maybe like the Itaewon clubbers or some groups or some companies not following those guidelines and then leading to these spikes, Now people are saying that they feel rage. They feel very angry towards these sort of groups of people. What are your concerns about that, or is that a very natural thing that we have to go through?
I think it's a very natural thing. One of the things, and again, just because it's natural doesn't mean it's okay or that we should just allow it to happen. But part of the nature of this is that because of COVID, people are not able to go out and interact with others, and thus interacting with others, going out, engaging in activities, working hard, all of these things tend to help our emotions peter out a little bit. But when we're sitting and just pondering on our thoughts and feelings and just watching the news constantly on COVID and watching these people partying or acting irresponsibly, then I think because we ruminate, and we know that rumination is not so helpful to our mental health, but because of the current situation, a lot of us have a lot more time to ruminate than we would usually. I think that this is actually contributing to the rage and anger because we're sitting there and just thinking about it and thinking about, and actually attributing our difficulty with lockdown, lengthening to these the irresponsible behavior of others.
So, Dr. Park, then what would be your advice to people who are maybe simmering in anger or feeling that rage constantly and are maybe ruminating over it too much?
One recommendation might be just because we can't go out much doesn't mean that we can't connect to people that we care about and our friends and acquaintances. So I would recommend that you try to connect to the people that you care about, people that you haven't reached out to because you haven't had much time. And because sometimes a lot of people are working from home these days and have easy access to Skype or Hangout or Zoom. My recommendation would be to reach out and to sort of disperse the feelings rather than simmering.
Mm-hmm. Korea has been fortunate than other countries in that we were able to avoid a complete shutdown or lockdown. For example, in the U.S., there was a recent result that came out that a third of Americans are actually showing clinical anxiety or depression. So that seems to be a very alarming sign of probably what you mentioned, that loneliness, extreme loneliness, being cooped up inside, ruminating with those negative thoughts. But here in Korea, we've had relative freedom. We were asked to conduct the social distancing measures, and we did abide by them for the most part. But of course, there are groups here in Korea that are living alone, and loneliness and social isolation is constantly a problem that leads to many other different or bigger problems as well. So I want to ask you, obviously, all groups are susceptible to loneliness and the ill effects on our mental health because of that. But is there a particular group, whether it's by age or maybe by profession, that concerns you the most or we should be more on the lookout for?
Overall, people find that elderly men without wives are the group that is supposed to be at greatest risk for suicide and also for depression.
Why is that?
Because oftentimes people find that women, even elderly women, are pretty good at getting together, sharing, connecting, whereas older men, possibly because of socialization and cultural practices, are simply not used to. They may gather in groups, but they're not used to connecting with each other, laughing and crying together,
sharing their feelings.
This is not so common in older men, and often men do this most with their wives. And so when their wives pass away or they don't have wives, often the wife is the conduit to their connection to other sort of families and men sometimes. And sometimes men who've worked their whole lives and don't have a great connection to their children are really quite alone.
At the same time, that survey that I mentioned by the Kyunghee Research Institute actually found that the biggest sort of group suffering from anxiety or depression were actually housewives. I think because of the 2 months or so of the strict social distancing that we had when kids were at home, their husbands were at home, the housewives were in charge of taking care of all of these members. and not only their physical health, but also maybe being that mental soundboard as well. So they were feeling depressed and anxious as well. And I think that families, maybe not used to spending so much time together under not the most natural circumstances, there have been quite a few reports about the frictions caused there as well. What would your advice be for not only the housewives, but maybe the children who are faced with, spending too much time indoors, maybe going a little suffering from cabin fever, and even the men as well?
Right. So one thought that I have as I'm listening to the results of the study are that elderly men might not be the ones that would report that they're lonely and alone, right? Because we've just talked about difficulty reporting on their emotions. That being said, housewives are often considered to be the person that everybody in the family goes to when they feel bad. They expect that mom is going to solve their problems or listen to them, or that for the husbands as well, they often feel like their wives are the source of their emotional security. So it makes a lot of sense that the housewives might feel quite overburdened with having everybody cooped up in the house and everybody kind of pushing their emotions on them and expecting a solution when there is no solution. So I think that one thing that I've been recommending to a lot of people is for families to not just sit again and ruminate together, but more for families to sit and do things together. So one of the things that I've been recommending is just turning on some music and sharing what kind of music that they like. The kids can share the kind of music they like. Mom can turn on music she likes and share with one another what kind of music they like and dance to it. Movement always helps. Sometimes families can sort of sit down and play some fun, silly games together. There are a lot of games where people can sit in a circle and follow each other's movements. That can be adapted to younger children and can be kind of speeded up for older children to make it more fun. So do things together. Don't try to sit around and always keep talking. It's funny to hear this from a psychologist, but
leave the talking to the professionals, maybe. I can imagine that sometimes maybe you need a little time alone as well, even if you are cooped up in the same house. Take some time out in your own room if your room allows that, of course. Lastly, Dr. Park, I did want to ask you, for those people who maybe do not have many family members who are living alone, whatnot, and they are left to their own devices and they don't want to worry about this, they don't want to be depressed, what sort of advice would you give them to stop this anxiety, I guess, over COVID-19 from sort of taking over?
Well, I think that at this point, again, because there's so much news about COVID-19 all over the world and in Korea, I would recommend limiting some screen time. So if you find that you're watching hours and hours of the news per day, I would recommend that you stop it and just try to watch, one news show so that you have enough information but do not get overwhelmed. The second thing that I recommend for housewives as well as for everyone else is that this is a trying time. Give yourself a break. Say to yourself, you know what? Makes sense that I feel this way. I feel helplessness because, again, we are all sort of helpless together. I feel rage and anger because of uncertainty, because we don't know what's going on. Say to yourself, hey, that makes a lot of sense.
Right.
It makes sense that I'm feeling this way. And again, for housewives and people who are prone to feeling guilty about taking care of themselves, do not feel guilty to take some time to give yourself a little gift of time or something funny.
Or maybe even something material or whatnot, or just allowing yourself that forgiveness to feel all those different emotions. Thank you very much, Dr. Park. We're going to have to leave it there.